So without further ado, please let me introduce Sandra Blake and Emma Louise Day from Barts Health NHS Trust with their work on NHS research records, reducing risk. So Barts Health NHS Trust has implemented this specialist digital archive that ensures records from clinical trials are preserved, accessible and usable for their whole retention period, which is mainly 25 years. You told us at the time last year that this service is now being extended to other NHS trusts who are finding it difficult to procure and archive themselves, so thus helping to preserve data within wider healthcare research and raising awareness of digital preservation in this area too. So I'm not going to say any more. That was the blurb that came with your award nomination. So Sandra and Emma, I'm going to drive the presentation for you. So let me just share the screen and then I'll let you take it away. And just make sure I've got that right. Is that visible to you all? Oh, you're there. When I show my screen, I can't see anyone. Take it away, Sandra, please.
Great, thanks very much, Sarah. Good afternoon, everyone. As Sarah just said, I'm Sandra Blake, and I'm the Corporate Records Manager at Barts Health. So I've been with Barts since 2018, and I'm delighted to talk to you all about the progress we've made since then regarding digital preservation. I'll be covering the first part of our project, and then I'll hand you over to my colleague Emma, our Corporate Records Officer. Next slide, please. Thank you. So Barts has a really ambitious research strategy, and it's involved in lots of different research. I lead the records management service that advises on records management and arranges the transfer and storage of non-active records across the trust. We receive income for storing and managing the paper records of clinical trials once they've closed, and we've been storing the paper records for several years now. Prior to 2020, there had always been a small number of records that were digital, but it was nothing to cause concern. We would see things like USBs, CDs and DVDs in the boxes of paper, which we recommended wasn't done, but due to the low numbers, we just uploaded them onto our own shared drive. However, that all changed from 2020. From 2020, we started receiving multiple requests to store more digital files, which we'd never had before. And we knew this was just going to increase over time, especially once the trial master files become born digital, which isn't far away at all now. It was expected by research teams and sponsors that the Trust would accept these digital records, as we had done with all the paper files. But unfortunately, before 2022, we were having to inform teams that we couldn't accept any digital files, as we just didn't have an approved data storage facility that met all the requirements for storing research records. Next slide, please. So unfortunately, that meant that we couldn't actually provide a full record storage service to research teams. When asked what they should do with their digital files, we were having to suggest that they either print out the files and transfer the paper copies to records management, or if that wasn't an option, to store the data securely wherever possible. Now, neither of these options are advisable from a records management perspective at all, especially printing out hundreds of pages of records in a different format to the original, and it did create additional work and concern for the research teams. As a result, some staff were resorting to putting the USBs and CDs in with the paper records, regardless of the recommendation not to. The difference this time was that we no longer had an on-site record centre where we could physically check the boxes before storing. Since our office move, all the records are sent directly to deep external storage, where the boxes will literally just sit on a shelf for decades. So any digital media in those boxes will deteriorate over time and the records will be inaccessible. Next slide, please. So this is the research section of our Trust Records Retention Schedule. It advises that most closed study records are retained for 25 years, and this applies to both paper and digital. Well, 25 years isn't very long for paper, but it is for digital records. And although these records aren't for permanent preservation, they generally need to be treated as if they are. So it's quite a long retention period for those. Next slide, please. So as you can see on the slide there, the actions we were having to take, because we didn't have an approved digital archive, meant that we were putting the records at significant risk of loss and corruption. Even printing the files onto paper put them at risk because they weren't in their original format. Regarding the CDs and the USBs, this was an issue because these only last for around 5 to 8 years, I believe. So any records left on these will be inaccessible for the majority of their retention. Next slide, please. We have some more risks here. Some of these are information governance risks, which do need to be taken seriously. Records need to be held securely, and only the appropriate people should have the right kind of access to them. Research is very heavily regulated, so there are quite a few risks associated with storing these types of records. And unfortunately, these risks all have potential consequences, which include things like the vital research data being corrupted, so it's inaccessible and unusable, information not being easily found or is lost, files becoming obsolete as technology advances, which it does seem to be doing very quickly, the inability to record a full audit trail, so we can't guarantee the security of the data, the inability to meet rigorous research quality standards, the right people not having access to the right data when they need it, meaning that work is hindered, data protection legislation being breached due to inappropriate security levels, access and retention of confidential data, and only part of a study's data being accessible if the paper files are in storage, but the digital files haven't been accepted and are unobtainable. Next slide, please. As the urgency to take in digital records increased, which it was doing quite quickly, it was obvious that we needed some sort of interim solution until a specialist repository was in place. While I worked on a business case to procure a suitable system, I also worked with a consultancy to create a bespoke SharePoint site. This site has a Power App that enables the easy and secure upload of closed study records by the research teams themselves. So it ensures that the records are held securely in one location where we have oversight. I will stress, though, that this could only be temporary, and I did stress this at the time as well. So while it mitigated the risks around security and loss, it didn't reduce the risks around preservation and usability in the long term. Digital records need active preservation methods, which SharePoint just doesn't provide, as that's not what it's designed for. Even though we now have an approved digital archive available, we do still use the SharePoint site as it's an easy way for teams to transfer their records to us so we can store them and then ingest them into the repository when convenient. Next slide, please. This is the main page of the SharePoint site, just to show you what it looks like. The Power App enables an automated process whereby a new folder is automatically created for each study. And so once a member of staff has inputted all the required metadata, all of the metadata that we required, then once they have done that, a high-level folder would automatically be created for that study, including the subfolders. And then once the folder is marked as complete by the member of the research team, their access is then revoked. And if access is needed later on, that's not a problem because they can request access again and it can be easily granted. Next slide, please. So starting the business case for a digital archive, I realised quite early on that it would need to be linked to risk. So as I discussed earlier, the risks associated with not having a specialist repository were significant. I carried out a risk assessment and ensured the risk was approved and placed on the Trust risk register before I submitted the feasibility proposal. And it was a high scoring risk for BARTs, which helped to demonstrate the necessity for a full digital archive. The action plan to mitigate the risk was to procure a specialist repository that meets all the standards for research records. I could quite clearly demonstrate that there was no other option that would mitigate all elements of the risk. Next slide, please. Thank you. So the Investment Steering Committee, which was the committee that reviewed all applications for funding of the Trust, fortunately, they were unable to grant funding for the system due to the financial position of the Trust. Luckily, though, very luckily, my department was actually able to fund it through the income that we received for storing the paper records. So although additional funding wasn't received as hoped, it was beneficial to know that we did have group executive board support for procuring the digital archive. They were supportive of it. And this was an exciting time, as no other NHS trusts had achieved this before. We're the first to procure an approved digital archive solution for research data. I'll now hand you over to my colleague Emma, who can go through the rest of the project with you.
Great, thanks, Sandra. Hi, everyone. Next slide, please, Sarah. So the system that we procured is Archivum, which provides cloud-hosted digital preservation technology using a software as a service subscription model. It specifically meets the rigorous requirements for storing and preserving life sciences and clinical research data, which is why we chose it over any other vendors or systems. There weren't any other solutions in the sector that could meet both research regulations and digital preservation requirements that apply to non-research collections. Because of this, we're able to use it across research records, corporate records, and the archives team are able to use it for their archival collections as well. Archivum is certified compliant with ISOs 9001 and 27001. So 9001 is the international standard that defines the requirements for a quality management system. Essentially, this means that they're able to manage their processes and systems in line with principles of continuous improvement, and means that they have a framework in place to ensure consistent and controlled quality improvement. ISO 27001 is the international standard for information security. So the fact that they're certified in both of these really gives us assurance that our data is managed and safeguarded properly. It's also compliant with the MHRA's guidance on good practice data integrity. So that's the Medicines and Healthcare Products Regulatory Agency. And it's been assessed through the NHS Data Security and Protection Toolkit, and also adheres to the National Data Guardian's 10 data security standards. Next slide, please. So how it works is that from our locally held data sources, we are able to ingest files, metadata, and data sets into the system. It then completes a pre-ingest validation check of any metadata we provide against the files that we're ingesting. During ingest, the system encrypts the data. It runs a virus scan and rejects any files that are flagged as viruses, alerting us to any potential risk. And it also completes a fixity check, providing a checksum that we are able to match to our files locally. It also automatically extracts some technical metadata from the ingest and applies any bespoke metadata that we have assigned to the records. Once ingested, the data is safeguarded by being encrypted and stored in multiple locations. The system runs regular fixity checks on the data stored. So again, it runs new checksums to make sure that the data has maintained its integrity. And a copy is kept in escrow with a third party for retrieval in the event that anything happens to Archivum as a business. So this means that we can still get our files back if Archivum goes under, and protects us from future loss. We're also able to apply bespoke retention management processes, so we can be assured that we're not holding data for longer than we need to. Any data that's identified for preservation is normalized, and it creates preservation and access copies, and it also produces archival information packages. The system's discovery and access processes also mean that we're always able to access our data, and we can also manage access for others as well. So we could give an auditor temporary access to a specific research study, for example. Any metadata provided or extracted is also completely searchable, and we can browse our records using an interface similar to File Explorer. Archivum manage data according to a few data management principles, including the FAIR principles and Alcoa Plus. I'll just run through those really quickly, just for a bit of kind of context. So FAIR is the data management principles of being findable, accessible, interoperable, and reusable. A key aspect of being able to find your data is making sure that it has robust and accurate metadata. So Archivum allows us to apply bespoke metadata fields as well as automatically extracting technical metadata. Archivum keeps our data accessible to us and enables us to create user profiles that mean any other users have access. And we can also restrict that access so that people can't access things that they shouldn't basically. Archivum are also expanding the number of systems that they can provide interoperability with for smoother and more automated ingest and transfer. And we think that we will really benefit from this in the future when our research teams start to use electronic trial master file systems. And then because of its safeguarding and preservation processes, it also lets us rest easy knowing that our data will be readable and usable in the future. The Alcoa principles are a set of guidelines widely used in regulated industries to ensure data integrity. They were initially developed by the FDA, so the USA Food and Drug Administration, to ensure the reliability and authenticity of data in the pharmaceutical industry. Over time, they've been adopted and adapted by various industries that rely on accurate and trustworthy data. They're also regularly referenced by other regulatory bodies, such as the European Medicines Agency and also the MHRA. These principles provide a framework for data management throughout its life cycle, from creation to long-term storage, and if required, its destruction. So they emphasize the importance of data being attributable to a specific individual or system, legible and easily understood, captured in a contemporaneous and original manner, accurate and reflecting true values, complete and leaving no gaps, consistent in format and presentation, and enduring and resistant to degradation. Next slide, please. Thank you. So we've now ingested all of the research studies that have been sent to us. And you can see on the slide there, so this is the PCDM Explorer on Archivum. And this basically lets us browse our collections. So the research studies kind of hierarchy is on the left, and the files are on the right. I've opened out one of the study folders so you can see how it's all laid out. Archivum builds this structure out based on the file path metadata we give it during ingest. So we are able to store it under the same structure as when it was in use. You can also see the preservation copies and the AIP files there as well. We've also been able to set bespoke fees for commercial sponsors to store their digital research records, which we don't think anyone else has done yet. The national guidance still refers to setting fees based on boxes of paper, so we think we're ahead of the curve on this. Aside from research records, we've started engaging with corporate services to start ingesting other record types as well that have long retention periods. Next slide, please. So here we have a couple of other functions in the system I thought it was worth mentioning. At the top, you can see the retention labels that we've created so far, which we can apply to records in the system. We've arranged these based on action dates, so we can embed this process into our existing disposals process, and so that we can easily locate records that are due for review or disposal. We've assigned a review action to all of the ones we have at the moment, because we only have research studies, and we would not dispose of records without the record owner's approval anyway. But we could also assign archival review to any files that might have historical value. The other benefit of using this system is that the archives team can then directly access these files to review, and they can then let us know which files they want to accession and which ones we can continue the disposal process with. And then underneath, I've just included a screenshot of all the reporting functions that we have access to. It's currently open to the audit trail and filtered to my own user ID, but you can see that it logs every action taken within the system, and we can also document a reason alongside it if it's not clear from the action itself. So there's a very clear kind of auditable trail of everything that happens to everything we put in the system. We can also produce ingest, preservation, normalization, and deletion reports. These are the ones that we use most frequently, but you can see on the left-hand side there are a whole host of reports available that we could make use of. Next slide, please. Thank you. So in 2025 and beyond, we're expanding the service to other NHS organisations, which we're fully set up and ready for. We're currently engaging with potential customers and Archivum to gauge requirements and to determine the best model for each trust. Winning this award has definitely generated a lot more interest, so that's absolutely brilliant. And we're also displaying a poster at the Archivum stall at the NHS Research and Development Forum conference in May. This is going to be a huge advertising opportunity for us. After we spoke at the RDF 24, it generated massive interest, and Archivum were inundated with inquiries, and it sparked a lot of conversations and expressions of interest from other trusts. We're yet to have our first customer, but that's unsurprising given the current financial climate and NHS red tape. But we do know that several trusts are currently writing business cases based on our advice. And final slide, please, Sarah. So that's it from us. Thank you very, very much for selecting us for this award and for giving us the opportunity to speak here. If there are any questions or anyone wants any information outside of this webinar, we've put our email address there, so feel free to email us at that email address. And yeah, thank you.